Thanks so much, Astrida, and thanks so much for everyone's being here. We're really delighted that so many of you have joined, and there was a lot of interest in these talks that we put on as part of our community outreach program at the Mass General Hospital and our Alzheimer's Center. Today, I'm going to talk about one simple equation. I'm going to just put my slides up here. Everyone see the screen? All right. So the equation I'm going to talk about is the one shown here: cardiovascular health equals brain health. Many of you may not have been expecting a maths lecture, but here we are. So I'm a neurologist that specializes in stroke and dementia, and I work in the Massachusetts Alzheimer's Disease Research Center, and our group does research on the overlap between stroke and memory loss, and why stroke and vascular disease is so important to understanding brain health. So, as we all know, things change as we age. We don't look as youthful as we once did when we were young. We may not be able to run as fast as we did several years ago. We may not play tennis as well as we did in high school, or we may not be able to read without needing glasses, something I'm still trying to resist. But if it doesn't happen to everyone, as we all know. I myself remain deeply jealous of some of the 80-year-olds at my tennis club who are far more athletic in their abilities than I ever was or will be. So just like on the outside, the inside changes too. But again, it doesn't happen to everybody. While some look just as youthful as they did when they were younger, the brain shown here on the left panel, others dramatically change almost beyond recognition as they age. The brain shown on the right, which has evidence of severe shrinkage and the scars of Alzheimer's disease and changes in the neurons and blood vessels. Silent stroke can be a major sign of a rapidly aging brain. We now can routinely see many of these signs of silent stroke using sensitive MRI scans that are widely available in most hospitals. These strokes occur because of changes in the blood vessels in the brain and blood vessels elsewhere in the body. And one of these major causes of these changes is cardiovascular disease. Brain networks within the brain, because of strokes, can be disrupted. And these disruptions are kind of like a disruption in a highway system that links different areas of the brain with each other. So when this highway system is disrupted, as shown here in this illustrative figure, this weakens memory and our cognitive processes. So we can't do things as quickly or as sharply as we did before having these strokes. So we can show that these disruptions actually affect brain speed and how we process information using some fancy imaging techniques shown here, as well as some mathematical analyses to show how connections decay with these types of interruptions. So how does one prevent this from happening? The answer is rhizotaiso. or physical activity, for those of us who are less familiar with Japanese culture. Physical inactivity, as shown here in this slide, have a tremendous health burden on populations around the world. The number of conditions caused by physical inactivity is staggering. Depression and anxiety are now commonly seen in young people, shown here in the slide, in the blue figure, in the blue part of the figure. High blood pressure or hypertension, which I will focus on today, affects nearly half the population of the world. Heart disease, diabetes, and so on, as shown here on this slide, all in some way related to physical inactivity. So we need to talk about blood pressure. Does blood pressure matter? Hypertension is highly prevalent. High blood pressure is highly prevalent in individuals over 60, and the population who really is at most risk for cognitive impairment and dementia. Nearly 30% of adults with a diagnosis of hypertension are inadequately treated. Using new guidelines for hypertension by the American Heart Association, only 47% of individuals with a diagnosis of high blood pressure or hypertension are adequately treated. So it's a staggering number of people who have a diagnosis and know they have a diagnosis, but then are not sufficiently treated to lower that blood pressure to safer levels. High blood pressure plays a pivotal role in the development of stroke, dementia, and silent or subclinical brain disease. However, the positive associations of blood pressure level with risk of stroke and dementia appear to change as we go through life. And late in life, low blood pressure values may actually be associated with increased memory loss. Blood pressure has a strong effect on bleeding strokes, which also can be silent. These data from a study that we did several years ago and published in JAMA show that blood pressure has an exponential effect on the risk of an individual having stroke down the line. Beyond stroke itself and the blood vessels, blood pressure also has a direct effect on Alzheimer's pathology, those changes in the neurons that I showed in my earlier slide. So blood pressure can actually change the neurons as well as causing changes in blood vessels. Both of these combined causes changes in memory and can cause dementia. So lack of physical exercise increases blood pressure, and regular exercise lowers it. But lack of exercise also does a lot of other things. As shown here in this slide, lack of exercise increases obesity with the perfect storm of poor diet, social isolation, and increased screen use, which leads to more inactivity, has caused an epidemic of obesity worldwide, and especially in the United States. Obesity has nearly tripled since 1960 and is continuing to increase and presents significant health problems, not only in brain health, but in cardiovascular health, diabetes, and a ton of other health conditions. So some exercise helps, but exercise alone, like a hamster running on a wheel in its cage, won't help hamsters do math. I sometimes feel like we all are hamsters running on treadmills in our own individual cages. So exercise is good, but exercise is better and improves memory when there's a social component to it. So both exercise and leisure activities work in a social context. This is work from a Japanese colleague of mine, Dr. Tamaya in Tokyo, who did a nationwide survey, health survey of Japanese older individuals who are carefully followed in a national register, and has shown that these social activities and physical exercise really work and have the strongest effect on memory and brain health when done in a social context. Japanese people seem to intuitively have understood this, and the elderly population engages often in social activity and exercise in this social context. So, what does social isolation do? Social isolation, we're learning more and more about as the years go on, but it really is an important factor in health outcomes and overall brain health. Growing evidence suggests that social isolations may be a risk factor for dementia, but then also be a risk factor to increase high blood pressure or hypertension, increase heart disease, and depression. Growing evidence from the COVID pandemic shows that social isolation worsened cognition and mental health in our elderly patients with memory problems, but then also in the young, and even in elderly people without cognitive impairment. These issues really raise questions about the healthcare providers and healthcare in general being aware of social isolation and its effects on human health. These key issues can impact overall health of individuals in the society and arguably are one of the key factors to overall health outcomes. So getting out there to see our tree friends and human friends is really, really important. So we've all been to parties where we don't like the company. This is a fate worse than social isolation, one might say. And indeed, I would agree with you. So how does one go beyond social to something that is actually beneficial? And the answer there is purpose. The key is purpose in life. And purpose in life correlates with numerous markers of brain health. So social itself is important only in the context of purpose. So you have to be social, but you have to be social with a purpose. Purpose in life really reflects this idea of one's subjective sense of meaning, right? It's what you bring to your own life, and how that gives an individual meaning, investment or engagement in their life experiences and their events. Purpose in life is really strongly associated with a range of favorable health outcomes and financial outcomes, as well as decreased disability in older life, mortality, and less cardiovascular events and stroke, greater financial wealth, and actually decreased risk of Alzheimer's disease and mild cognitive impairment. Purpose of life may be robust. This idea of purpose seems to apply in numerous different populations around the world and seems to be a general biological principle. Purpose can be derived from a variety of sources, as I tell my own patients: volunteering, engaging in philanthropic organizations, educational, family-based activities, etc. So this new film by the German director Wim Wenders called Perfect Days is showing in theaters now. And many of you may know the song by Lou Reed, which, along with some of its cousins from that generation, make a cameo appearance in the film. If you forget everything I said today, I recommend watching the film, which says it much, much better than me. This man, played by the brilliant Japanese actor Koji Yakosho, embodies everything I talked about in this lecture on purpose, cardiovascular health, and brain health. Why does he do that? Well, the character in the film has brain health. Why does he have brain health? He has cardiovascular health. Where does his cardiovascular health come from? His blood pressure is normal. He's not obese. He eats well, consequently doesn't have diabetes, and his cholesterol is well controlled. He does this through regular exercise, physical activity that's really goal-oriented, and with a strong social component, as well as his diet. And he has a purpose. And that purpose drives these other consequences. And finally, this purpose not only has these health effects, this purpose is linked to his sense of community, his sense of social connection. So I think in summary, what I would say, and I often tell my patients, one pill is not going to save your life. It really is a lot of different factors together that play a synergistic role, that play together to help us all preserve brain health. And so as we age, thinking about these different things to impact our cardiovascular health, increase our physical activity, have a purpose and social engagement with those around us, it really is a key to living a healthy and cognitively normal life. So I'll end there. This is work and research that we've done in our center at the Massachusetts Alzheimer's Disease Center, as well as the stroke service at the Mass General Hospital, and our own research group at the Mass General. So thanks very much for your attention.
All right, thank you, Dr. V. That was really informative. So I know you all have your own reasons for tuning into this program, and I was asked to participate today because I do too. I'm part of the AHEAD study at the Center for Alzheimer's Research and Treatment at Brigham and Women's for the use of lecanemab for people who are at risk of developing Alzheimer's but don't have a diagnosis yet. For me, taking part in this study is a way to face down a future that frankly scares me. My grandmother, her sister, my mother, and my aunt all died of Alzheimer's. My mother right before the pandemic and my aunt 2 years ago. So I've seen firsthand too many times what this disease does to the person who gets lost to it and to the people who love and care for them. And I don't want it for myself or for my loved ones, and I don't want it for my own child, who was already worrying about it. For me, when faced with something big I can't change, I cope by taking some sort of action. When my child had to live at Children's Hospital for weeks, I turned the room into a comforting space that felt more like home. When COVID hit, before masks were available, I made and donated 1,000 of them. So when I read about the AHEAD study in an email from the Alzheimer's Prevention Registry, I knew I wanted to be part of it, and I applied. And the day they said I qualified was both wonderful and horrible at the same time, because it was confirmation of my fears of what might be looming for me. I live in southern Maine, and for 2 years, I drove 1 hour to 2 hours each way every 2 weeks to get my infusion. I'm halfway through the study now, so I only have to go once a month. And I can say it's totally worth it. Even if I'm getting the placebo, it's worth it. Even if this drug doesn't wind up being the answer, it's still worth it. Because science needs to explore all the options before it can find one that works. And I'm not a research scientist. I can't stop this myself. I can't find the cure myself, but as a study participant, I can still do my part to stop the disease. And I encourage you to think about doing the same. Researchers like Dr. V make a difference, but they can't do it alone. They need us. So with that, I'll turn it back over to the questions if people have any. To remind you once again to please, if you can, answer the survey that you'll be getting so that we can make these programs the best they can be. Thanks.